Good morning, everyone. Will DuPree here in the KXAN live studio. This morning, we're continuing our reporting about the COVID-19 pandemic here in the Austin-Travis County area. And fortunately, I have in the studio with me this morning our morning anchor, Sally Hernandez, here to join me to ask some questions of an official that we have a few for this morning. Sally, good morning and thank you for being here.
Good morning, Will. Thanks for having me.
Yeah, and we want to bring in our guest now. It is Mayor Steve Adler. He's joining us from home at the moment to take some questions about the city's ongoing response. So Sally, I think you should kick things off for us.
Thank you, Will. Thank you, Mayor, for joining us today.
Good morning, Sally.
Let's talk about the number of cases that we have confirmed so far here in Austin-Travis County, more than 500. Do you have an updated number as far as how many cases have been confirmed this morning?
Well, we have the 552. We have 7 people who have passed away.
That is up one person from the day before. What is that telling you when it comes to just how brutal and deadly this virus is?
Well, one, we know that it is both brutal and deadly, and we know that it's incredibly infectious. It just spreads so much more quickly than the flu does. That's why it's real important for us in this community to separate as much as we can to stop that infection from spreading, to buy time and to lower what would be an onslaught onto our healthcare system. But it's certainly something that, as we know, is just shaking the world.
Some counties like Williamson and Hayes County are reporting more information about these numbers in COVID-19, including hospitalizations, how many people have recovered from this virus, and positive cases by demographics. Why are we not doing that here in Austin?
Well, we need to do that too, and we'll be posting the numbers with respect to the demographics. We've been tracking that number, and we need to post it so that people can see it, and so that we can find out if there are trends in our community as well. Now that we have enough numbers, it's going to give us an indication that might very well be statistically significant. So we need to do that. We do post the number of confirmed cases, of positive cases. There's a limited help knowing that number, because there are certainly a lot of positive cases that are not officially confirmed. There are people in our city that get a fever and they self-isolate and they get better and they never end up on the system. As we get more tests, we're going to be checking more and more people, so we would expect the positive number to go up. So the real number, I think, we're going to start tracking here and looking at and using in our models is hospitalizations. So we're going to start looking at that number every day, because the hospitalization number is independent of the number of people that we test, and it's a good way for us to track the virus. So we'll be getting that information out as well.
On that same note, some researchers at the University of Texas Health Science Center have mapped the neighborhoods in Texas where we are most likely to see the most severe cases of COVID-19. A lot of the hot zones, if you will, from the researchers are on the east side of the city, east of I-35. Many of them correspond with areas where nearly a quarter of the population, Mayor, lives in poverty. Are you familiar with that research? And if not, given the facts that I just told you from researchers, are we starting to see this virus target the poor?
Well, I'm not sure exactly the study that you're talking about, but I do see, and we publish every day where our cases are occurring by zip code in the city. So that's information that's posted for everyone to see. You know, in a lot of respects, when we talk about clusters in the city, you're not necessarily talking about something that is a geographic-based occurrence. You can have people that all went to the same party, and there was someone at that party that carried the virus, and people were infected, and then they went back to their different parts of the city. But we tracked that cluster because it all arose from the same occasion. We had students that came back from a trip and then dispersed to some degree in our city, so they were in different places. I am concerned about the impact that this could have on the east side of our city, in part because so many of the people that are doing construction in our city live on the east side of town. And now the construction is moving forward by the governor's order. If the construction sites don't properly mitigate and protect those workers, it could easily be that we develop multiple clusters coming off the construction activity that could be downtown, but then we see it in people on the east side of town. We need to make sure that everyone in our city is getting to the hospital when they need to. And if we have parts of our community that are afraid to go to hospitals because they're afraid of what might happen if they interact with the system, or afraid that they might be deported or leave the country, which, by the way, will not happen because we don't check in hospitals as far as documentation status. But if we have a community of folks that are more resistant or leery of going to a hospital, that is also a concern. If we have families that are living together, more people in a closed space, that's a concern. If we have people that are more prone to be living with a grandmother as part of the family that's living together, that's a concern. So one of the populations and communities that we're watching most closely right now are the communities on the east side of town.
Mayor, when it comes to the parks, the trails, the green belts, which you have closed because it's an effort to fight this pandemic, what else is on the table when it comes to closures? What else can you do if social distancing is not working? What else can we see closed or off limits in Austin?
Well, we know that the community is actually doing a pretty good job with physical distancing. And we have to start by going there. Still a lot more we can and need to do. But if you go to a site like unicast.com, it measures the distance that cell phones are traveling in the community, and it grades every county in the country by how the distance that cell phones are traveling today as compared to what they were doing before the virus came. Austin is ranking pretty high among counties. But we know that our ranking is in part dependent in this city on how pretty a day it is. So on days when it's raining and overcast, we're one of the best in the country. On days that are really pretty, we have too many people that are out in groups in parks and in other areas. So this weekend we are going to close the trails and the parks. It's Easter weekend, and everybody wants to spend this time with their families and cookouts and friends, and we're going to be longing for that, especially this weekend because we've all been inside so much. But it's real important that we not do that, and for that reason, then we're putting a special emphasis on making sure that people don't aggregate and gather. We're going to close the trails and the parks. But ultimately, whether we're able to create physical distancing that works is going to be most dependent on what people do. It's individual choices, individual decisions that are being made that then cumulatively become our community action. We have code out to enforce things. We have our public safety people out to enforce things. But there are just too many people in too many places. If this works, it's going to be something that it's something that the community wants. This week we did move forward and recommend that people wear face coverings. I think that's a really good thing for people to do if they go out, especially if you go to a place like a grocery store. We have clerks in these stores that are the economic first responders. They're out with the public. The least we can do for those folks is to wear face coverings in the stores. Putting on a face covering doesn't mean you don't have to pay attention to the 6 feet. You still absolutely do. Putting on a face covering doesn't protect you from getting the virus. What it does is it protects against you infecting others because it blocks what you might, if you sneeze or something like that. So if we all wear masks and the face coverings in the grocery store, we do a better job of protecting the people that work there. And frankly, if everybody in the grocery store would wear face coverings, then each one of us would get added protection too.
Speaking of face coverings, Mayor, how are city employees following that guidance? Are they being told to wear that whenever they're going on different routes or things like that? Can you explain what city employees are exactly doing with that guidance?
Well, at this point, city employees are under the same rules that the rest of the city is. It's a recommendation that people wear the face coverings, and you can make these in literally 30 seconds at home out of an old T-shirt without any sewing required. You can go online. My website has me doing it, but mayoradler.com, but you can also get it on YouTube and iTunes. City employees are under the same rules. Now, some of our city employees aren't wearing face coverings. They're actually wearing the masks, because some of the city employees, our first responders, are really putting themselves in positions where they can't abide by the 6-foot separation. These are the heroes in our community right now that are taking risks in order to keep the rest of us safe. The EMS workers, the fire department folks. We have some folks that are dealing with health issues and be wearing the same kind of masks that the frontline healthcare professionals wear. But by and large, most of the employees in the city under the same rules that all of us are under right now, and right now it's a recommendation to wear the face coverings.
If you're just joining us, I'm Will DuPree, and Sally Hernandez is joining us here in the KXAN live studio. We have Mayor Steve Adler on the line, answering some questions about the city's ongoing response to the COVID-19 pandemic. Continuing with our questions, Mayor Adler, yesterday the Texas Democratic Party filed a federal lawsuit against the governor and other state officials, including the Travis County clerk, about demanding a vote-by-mail system for the upcoming elections. Without commenting about that particular litigation, what are your thoughts about moving to that kind of system now, given this whole moment?
You know, I think moments like this really give us the opportunity to think outside the box, because we're all having to do that, and to question our habits and our customs, and to really see if there are new opportunities to do things in new and better ways. I've seen other jurisdictions that allow a greater number of people to vote and to vote by mail, and the elections seem to go fine in this country. That would make a lot of sense to me. Certainly with the illness that we have, we don't want people gathering, and we want to minimize lines that people are in. But voting, we do so much now without having to stand in line in all parts of our lives. And we want to encourage as many people to vote as we possibly can. So generally speaking, that makes perfect sense to me.
Mayor Adler, we're also getting some word from the National Coronavirus Task Force headed up by Vice President Mike Pence and the CDC that there may be some new guidance when it comes to people who have been exposed to someone who was infected with COVID-19, that they are allowed to go back to the job if that person is asymptomatic. In your opinion, as the mayor of Austin, is that a good thing for us in the city?
Well, for us, not yet, but eventually that kind of thing might very well make sense, and you know, there will be a backside to this virus, and we have to start planning now, and are planning now, as to what that looks like. How do you move from the condition and place that we're in right now to the next stage? And that's going to have people coming back to work. We're tracing right now and working with the people in our community that are known to recover. Those folks are donating serum, blood at this point that might contain antibodies. We're learning more about the resistance that someone has if they've had this virus, and for how long they might have that resistance. That's being studied all over the globe right now. But at some point, we'll be moving out of where we are to the resilient and recovery stage of this, and we're going to have to be looking at those things. But for right now, in our community, we want people to stay at home, except if they have an essential and critical job, and we want everybody to maintain that 6 feet and everybody to put on the face covering.
Okay, And Mayor, with what you know today, with all the briefings that you get from city officials, from the hospitals, from public health, with what you know today, when will we start to ease up some of those restrictions then?
Well, we don't know, to be honest. In part, that depends on how we do with the social distancing that we have. You know, if we didn't do any social distancing, then we have everybody, so many people getting sick all at the same time. It overwhelms our capacity at hospitals and the like. But it also brings us the peak more quickly than we would want. The better we're doing with social distancing, we flatten out that peak, but we also move it a little bit into the future. That gives us a little bit more time. So we heard this week in Washington that it was characterized as our Pearl Harbor week, and it was going to be a week that's very bad, and certainly that's true in New York and in some other cities that have been hit with a real devastating peak relatively early in the process. But this is going to roll across the country into different places, and the peak in different parts of the country are going to happen at different times depending on how the infection got introduced into those cities and what was the reaction of the communities when it happened. In Austin, the models that we had gotten and that we're operating under right now indicate that the peak for us will be late this month in April, maybe going into May. Those models that we saw don't reflect the work that this community has been doing on the physical separation. And if that works, and if that flattens out the curve, it could push us back another a couple weeks. So we'll know more as we get further into this. We'll know more in the next 10 days how our last 2 weeks has gone with the social distancing. It takes about 2 weeks for that to be reflected in infections, because someone who got infected 2 weeks ago has probably up to a week for it to incubate and manifest, and then up to another week before they end up getting tested and we get test results. So we're just now seeing, and we'll see the good that was done by the behavior change 2 weeks ago. We'll be able to put that into our model, and we'll know more about timing. What we know is that this isn't going to end as quickly as we all would like it to, but the numbers will be very public and transparent, and we'll all be looking at when we anticipate our peak to be.
For anybody who might be wondering when the stay-at-home order might be lifted, are you expecting it to be extended at this point?
You know, at this point, the expectation is that it'll be extended because our stay-at-home ordinance only runs until April 13th, ours and the order from the county judge. Both the president and the governor have their shelter-in-place ordinances extending through the month of April. So I would expect and anticipate that I'll extend my order, that the county judge will extend hers probably sometime before or over the weekend, and it'll go at least till the end of the month.
Mayor, we reported how the city of Hutto unfortunately laid off about 48 city employees because of COVID-19. Do you think the city of Austin is planning any layoffs or furloughs for its employees?
You know, at this point, we're not planning any layoffs or furloughs for city employees. We're into the process of taking a look at where we stand financially. You know, as obviously this has just rung the bell of governments and businesses and people all over the country. Austin's actually in a much stronger place than most other places. You know, the reserves that we have right now are double what they were when we went into the 2008 crisis. We set stronger, more stringent policies as a city as to the reserves we needed to maintain. And right now, the city is maintaining reserves that are $25 million in excess of what we had said were the reserves that we wanted to keep. We're going through the budget. We have already started the process of cutting spending and programs. The legislature passed that 3.5% cap. So we were already well into the process of doing that work. It continues right now. The city manager has implemented a hiring freeze in the city. We have a little over 550 jobs in the city right now that we're actively recruiting for. We're going to not hire for any of those positions as a general rule. So we're doing the things that are required of us, but we're still in the process right now of taking a look at all the things that we might have to do. We're getting a lot of money from the federal government, about $160 million. The Treasury Department is not clear quite yet on what we can spend that money for and what kind of expenses get reimbursed. So we're also trying to answer that question.
What would you like to spend the money on then? If you could just wave your magic wand and figure out where that money should be going in Austin, where would you allocate it?
Well, right now I would allocate money to those people that are suffering the most and are least able to deal with that financial pain. We have people in our city that have lost their jobs, probably about a third of the city. We have a lot of people that are being really inconvenienced, having to spend time and work at home, but luckily and fortunately, many of those people still have their jobs. But that third of the population that's lost their jobs, primarily in the service sector in our city, a lot of those folks don't have a good social safety net to fall back to. So if the money that we need to spend, and I think that the council's got to take action. It did Thursday a week ago with a resolution sponsored by Councilmember Flanagan, joined by the entire council. There's one by Mayor Pro Tem Garza coming up tomorrow. That's going to hopefully get money to and resources to and assistance to the people and the nonprofit social service organizations that are tending to the folks that are most at danger. Part of the money that we're spending is being spent to ensure that no one's utility bills are turned off, either water or electric, and we've done that. We have low interest loan programs for businesses to tide them over until the federal money starts coming in. But I think we're also going to try and get some money directly to the people that are hurting the most right now.
You talked about how you are concerned that this virus is maybe hitting people on the east side of I-35 especially hard. Nationally, when we take a look at the numbers as well, it seems like the African American community, the Black community, is being hit hard by this virus as well. Are you seeing that here in Austin? And if so, what are we going to do about it?
Well, like I say, those demographic numbers are going to be published here real quickly. I understood they might be published as early as today, so that we can all take a look at them. But I am concerned about those populations. Those populations seem to be oftentimes particularly susceptible to this virus, because this virus preys on people that have some measure of a pre-existing condition that makes them more vulnerable. So populations where diabetes is higher, or those kinds of things are populations that are most susceptible and the ones that we have to pay closest attention to. And that's going to be a focus of our city, especially now that construction activity has been opened up by the governor. We're going to be working really closely with the industry and the worker associations, the advocacy groups, to make sure that those sites are doing everything they can to mitigate the transfer of this virus in those work situations.
You touched a little bit about what is being done to fight this virus, just with some clinical trials. Antibodies is one that doctors and researchers are using, somebody who has been infected and then using that to help protect others. Is that happening in Austin hospitals? And if so, is it working, or do you have enough people who are volunteering to do that?
I know that a lot of the people that have been confirmed as positive have offered to donate serum, and I know that that's being collected by Dell Medical School. So there's research that's ongoing with respect to that. There's research ongoing in our city right now with respect to different kinds of testing protocols. As we get different kinds of tests in the city, some tests involve the swab that goes into your nose. Some tests involve looking for antibodies in blood. There are tests going on in our community on equipment and new models for ventilators that might be something that we could manufacture and produce. So while the work is happening with respect to treating the people that are ill, there is very much research that's going on, not only here, but across the country and across the world.
With that said, jobs that are being cut, we've talked about the hiring freeze within the city. There is a lot of anxiety right now, and it is hard for a lot of people to cope with all of this. KXAN here, we know that, and that's why we're focusing on mental health, Mayor, this week. And it has to do with helping people know that there are resources out there. Grief, anxiety, health concerns. How is the City of Austin helping people with these mental wellness issues?
It's a big concern. You know, I think that everyone is feeling the stress and anxiety associated with what's happening. Everybody's lives have been disrupted, and there's so much uncertainty on the horizon. You know, the only thing that we know for sure is that we're all in this together, and we're going to help one another come out of this on the back side of this. And as I said, there will be a backside. But that stress and those anxieties obviously hit and are held and impact different people differently. The city is doing a lot to try to encourage folks to make sure that if you can't physically go see everybody, that you call them up on the telephone or FaceTime or Skype with people to try to address the loneliness that many people are feeling. You know, it's physical separation, not social separation, and we have to remember that. But for those people that it hits the hardest, that really do need more, professional or focused assistance, the city gives a lot of support to integral care. And the Integral Care organization is the one right now that in our community is point on some of the more pressing mental health issues that we have in our community. In Integral Care, they're psychiatric emergency services, PES is what it's called. They provide visits by telephone and by telehealth. You can even arrange for an in-person visit with Integral Care by appointment. Integral Care has a 24/7 hotline 7 days a week, and I would urge anyone that felt the need for that, either for yourself or someone that you love or care about or know about, to make use of that hotline.
Once again, if you're just joining us, I'm DuPree. Sally Hernandez is here in the KXAN live studio asking questions of Mayor Steve Adler about the city's ongoing response about the COVID-19 pandemic. Mayor, just yesterday the city sent out a notice about virtual religious services happening here in the community. Passover starts this evening. Easter is this weekend. For anybody who might be wanting to celebrate with their loved ones, what is your advice? Because the governor's executive order has said that religious services are essential at this point.
You know, our ties to religion and faith absolutely are essential. But what I'm really excited is that the faith leaders in our community have managed to address the faith needs in our community in a remote and virtual kind of way. So our clergy, from Bishop Vasquez with the diocese to East Austin churches like Mount Zion with Reverend G.D. Clark, but also the temples with Rabbi Blumoff. All of them, and many, many others, have made wonderful use of the computers, of internet, of maintaining faith meetings in a virtual kind of way. We know that faith is important, but it's going to appear to us differently in different times. Now, the governor's order preempted our local order, which prohibited large groups from gathering in religious institutions. The governor's order trumped that. But in fairness to the governor, when he did that, he certainly expressed a preference for people to do their services remotely or at home. And he allowed for people to gather in churches only if those other things didn't work. So the governor was also encouraging people to do what people are doing in our city. One of the chief problems that South Korea had, and where the virus really got out of control in South Korea, concerned a patient that now gets referred to as patient 31. It was the 31st person to have a confirmed virus in South Korea. Ended up spreading to over 1,000 people in their community, one person, and it began at a church function. It's where people gather together, oftentimes people that are more susceptible to the virus, frequently an older, more senior community. So that can happen, and it could happen here, and that's why we are so appreciative that our local faith leaders are letting people participate in services remotely and virtually.
We had asked Governor Greg Abbott when he did a virtual town hall with us here at KXAN if he had been tested for COVID-19 himself. I'd like to pose that question to you, Mayor. Have you been tested for COVID-19? You have a pretty public job as well as he does. So can you tell us your status with that?
I have not been tested. I don't meet the protocols for being tested. So, no.
When it comes to other people who are being tested or who want to get tested, are you confident as mayor that the tests are available for anybody who does experience the symptoms to go and get tested for COVID-19?
Well, right now, people that have the symptoms, and there's a reason to believe that it could be virus related, have the ability to get access to tests. I would like us to be able to test more broadly than that. I would like us to get to a place where anyone who wants the test would have the ability to be able to get it. We don't have enough tests for that. And we're not sure exactly how many tests we'll get from week to week to week. So right now we are focusing our tests on the protocols, on the people that need it the most. We're focusing our tests on people that have the symptoms, people that have a known contact with someone that has the confirmed virus and the symptoms. For our first responders and our frontline healthcare workers, because they're being with people so much that are susceptible, and we need to best protect them and their families, as well as the patients and the people that they deal with. So at this point, we're prioritizing where our tests go. I would very much like for us to be able to open that up. We're not there quite yet.
We have investigated many nursing homes in the area where there have been outbreaks of COVID-19, and some of the frontline workers at those centers are saying they don't have enough protective equipment for themselves. Are you keeping up with that, and what is being done to protect them and to protect the most vulnerable, which can be the elderly?
We are spending a lot of time and effort focused on the populations that are most susceptible in our community. We've talked about some of them earlier on this cast. But nursing homes certainly among those groups that we have to watch. So we look at other cities where San Antonio, up north in the DFW area, where they've had a significant spread in nursing homes in Seattle. That hasn't happened to us yet. I hope that it doesn't. We have had a few cases that have been more isolated in 2 nursing homes, I think. Those folks have been isolated. We are bringing online a nursing home facility that can provide care for people that need that support, but are not so sick that they should go into a hospital. That will be just dedicated to people that are confirmed with the virus or need isolation. So we're focused on that population to make sure that we're doing everything that we can do. Rules about people going in and out, shouldn't be any visitors there, and the constant testing that's happening with people in those environments. We're also doing the same thing with the population that's experiencing homelessness in our community. Also a very susceptible population, and we have leased or purchased motels, isolation facilities, so that we can take people, as we have in that community, who test positive and immediately get them isolated or separated from the larger community population. But we have more capacity in those facilities right now, thank goodness, than we're having to use. But they've been stood up. They're available. We've arranged for food and for support for people that need to take advantage of those kinds of facilities, because quite frankly, a lot of people in our community are able to do the physical distancing and be at home and work remotely. But we have large parts of our population that can't do that the same way. And those are the populations that we really need to focus on to make sure that they're okay, and that we can work with them to contain the virus so it doesn't spread generally.
There are a lot of places that have adopted new ways of life at the moment. Do you see, once this pandemic passes, that some of those things that we've taken as precautions now in this moment might last past this time?
You know, the truth is, I think that life on the backside of this may very well look a little different than life going into it. I hope that's true. I hope that we really take advantage of the things that we're doing now that seem to make sense. I'm participating in a lot of meetings now with the technology, where I'll be in a meeting with the city council meeting yesterday. It was an example. You have 11 members of the city council, the city attorney, the city manager. We're all working remotely. We're on a screen that's divided up. You can see all my colleagues participating. The public can watch that through a live stream. That capacity to be able to meet remotely but see each other and talk to each other, to flash documents, show documents to each other on the screen, is a really neat technology. I would anticipate using that a lot more from here on out. Truth is that technology existed, obviously, before we went into the virus, and I never spent the time to figure out how to use it. By necessity, I am now. And I would expect that to move forward. But I think we may see other things like that, where we have received greater efficiency, or where we figure out how to do things in a more equitable way. I hope those things continue into the future.
Mayor, thank you for answering all of our questions here on KXAN Live. Is there anything that you would like to leave our viewers with as we close our conversation, something that you would like to remind people, or just knowing what you know today, the message that you would want to send?
Sally, thank you. And, at some point, I think I begin to feel like a broken record. But the things that we've been saying are so critically important. If you're not feeling well, don't go out. In fact, you shouldn't be going out at all unless it's critical and essential for you to do that. If you do go out, make sure that you maintain 6-foot distance, physical distance between you and other people. That's everywhere, the grocery store line. If you go to the grocery store, go by yourself. Don't take the family with you. And when you go out, it's recommended that you wear a face covering. It'll help protect everyone around you. And if everyone around you is wearing a face covering, then you get protection as well. These are hard times, and there is a lot of uncertainty and anxiety. But Austin is doing well. We started early on the curve. We started, we canceled South by, At the time we did that, there were a lot of people that didn't understand why we would take that drastic a step. It's apparent now. So Austin is positioned as well as we could be if everybody will participate and show the discipline necessary to help one another. We can save thousands of lives in our community if we individually and thus collectively decide that it's important. I think it is. I think this community thinks it is. We're gonna make this. I want everybody to take care. Be safe.
All right, everyone, that was Mayor Steve Adler here in Austin, joining Sally Hernandez and me here in the KXAN live studio, answering some questions. Mayor, thank you so much for joining us this morning. We really do appreciate that.
Well, thank you.
All right. Sally, good conversation there with the mayor.
Yeah, it was a good 40-minute conversation. Well, I thought that he answered all of our questions, and we learned some new things about what the city is doing when it comes to fighting this pandemic, whether it's looking at certain pockets of the city and ways to tackle that. So it was good information that I didn't know about just a few hours ago.
Correct, and he said that they're going to be sharing some potentially demographic-based information about these COVID-19 cases, so that will be a lot more data for us to be able to dig into and be able to share with you all at home.
You bet.
Yeah. Sally, thanks so much for joining us, and all of you who watch, we do appreciate that. Please stay with us. Coming up at noon today, Governor Greg Abbott is holding a press conference from the state capitol, and we'll be carrying that live on KXAN.com, the KXAN News app, and here on Facebook. So thank you for joining us once again, and we'll see you back here. Please stay safe, stay healthy, and if at all possible, stay at home.